Shining a Light on Poverty discussion series. This is the 9th in a year-long series of discussions that explore the many facets, challenges, and causes of poverty. Also, please plan on joining us next month on October 30th at noon when we will be discussing women and poverty issues with Carrie Brown, the Executive Director of the Vermont Commission on Women. For those joining us on the webinar today, following the presentation, there will be time for questions and discussion. You can ask a question at any time by typing your question into the chat box on your screen. And at the end of the webinar, you'll be asked to fill out a brief evaluation of the webinar, which will help us for future presentations. Today, our speakers are David Tucker and Joe Patrissi, and we will be discussing the collective impact model for social change and highlighting initial efforts to use the collective impact model to help break the cycle of poverty in St. Johnsbury, Vermont. Joe Patrissi has many years of public service in Vermont. Among his many roles, he was the Commissioner of Corrections and the Deputy Commissioner of Economic Services Division at DCF. He has been the Executive Director of the Northeast Kingdom Community Action Agency since 2010. In 2014, Joe was appointed to the Governor's Pathway from Poverty Council. David Tucker also has many years of experience working in community action and other nonprofit agencies. David is the former director of this office, the Vermont Office of Economic Opportunity. David's areas of expertise include conducting community needs and organizational assessments, facilitating strategic planning processes, establishing and monitoring measurable outcomes, and designing and implementing program policies. And we are really pleased to have them both here today to talk about the collective impact model. This is a model that our organization has been really interested in looking at for social change. So welcome, and I'm going to turn it over to David.
Thank you, Paul. Good morning, everyone. Thanks for joining us today. I guess to get started, I guess I'd like to talk a little bit about how I heard about collective impact. And I read a lot, so I started hearing about collective impact several years ago. The more I read and the more I pay attention to what's going on in social services, examples of collective impact kept coming up. There was a recent one in Australia where there's a group of over 200 leaders from government, business, philanthropy, nonprofits, and the community to explore and develop a national collective impact framework in Australia. So this is something that got me really interested. These are people on a national level really talking about this thing called collective impact. There are also lots of efforts in this country. Aware and Prepare in Santa Barbara County in California. Really, it's looking at disaster preparedness for the entire community. And Santa Barbara is a place that has, is threatened by wildfires, is threatened by earthquakes, and this was an effort to really prepare the whole community for a variety of potential disaster events. Also in Santa Barbara, sort of a spin-off of Aware and Prepare, there was an effort called Thrive Santa Barbara. And folks in Santa Barbara are looking at cradle-to-career education and training. And they're looking at that whole educational and job preparedness system. There's also region-wide efforts. There's an effort in Texas called Educate Texas, and it's in Dallas and in the Rio Grande Valley. And that looks at pre-K to college graduation. So it's taking youth from before they get into kindergarten and making efforts to improve college graduation rates. So it follows folks all the way through college graduation. There's also an initiative in Colorado Springs. Folks there were concerned about youth substance abuse, juvenile delinquency, youth crime, and they really are looking at improving those outcomes by the premise that successful families equal successful youth. So they're looking at those kinds of outcomes. A real prime example also is an effort in Cincinnati called Cincinnati Strive. And it has brought together local leaders to tackle student achievement and improve education throughout greater Cincinnati and northern Kentucky. And one of the things about this collective impact initiative is that the Strive partners have been able to improve student success in dozens of key areas across 3 large public school districts in Cincinnati and Northern Kentucky. And so even despite recession, budget cuts, that's typical these days, they've been able to achieve success in 34 of the 53 success indicators that they are tracking to show improvement in high school graduation rates, 4th grade reading and math scores, and the number of preschool children prepared for kindergarten. And there's one more example I'd like to talk briefly about, and that's 100,000 Homes. And 100,000 Homes is a national organization that has one collective impact initiative that's called Got Your Six, and it really focuses on improving outcomes for veterans. And it includes the entertainment industry with organizations and federal government. And it's really looking to improve veteran reintegration, looking at jobs, education, housing, health, family, and leadership. And it really aims to really change the conversation to ensure that veterans and military families are perceived as leaders in civic assets. So as I read, learned, heard about these and other initiatives, I finally decided, well, maybe I should go to the source. And the source of this is really an article that was first written in the Stanford Social Innovation Review in about 2011. And it really talked about collective impact as a large-scale social change that requires broad cross-sector coordination, and noted that for that to happen, that the social service sector really remains focused on the isolated intervention of individual organizations. So it started me thinking and asking questions about really how is this different from just a partnership or cross referrals or working more collaboratively. And really the collective impact approach really believes that no single policy, government department, organization, or program can tackle or solve the increasingly complex social problems we face today. And it really calls for multiple organizations from different sectors to abandon their own agenda in favor of a common agenda. That shared measurement and alignment of effort has to happen. That unlike sort of typical collaborations or partnerships, collective impact initiatives have a centralized infrastructure, and in the collective impact terminology, that's called a backbone organization. And that backbone organization has dedicated staff whose role is to help all the participating organizations shift from acting alone to acting in concert. So really collective impact is just that. It really focuses on what we can achieve together. So it's collective impact, not just collective effort. And I think the diversity, I think, is also a catchphrase, that it really does include a wide variety of folks from the public sector, the private sector, from government, from business, and community members. I think it might be important to note that it's really aimed at tackling deeply entrenched and complex social problems. And it's a really innovative approach, I think, and it's really structured to make collaboration work across various sectors and to get lots of different kinds of organizations thinking and talking about achieving lasting social change in a different way. I thought this might help to just sort of show the difference between sort of our traditional isolated impact and our approach to addressing social problems and how collective impact is different. Typically, funders select individual grantees that offers the most promising solutions. They give the grants to the folks who write the best grants. What collective impact does is ensure that funders and folks who implement programs understand that social problems and their solutions arise from the interaction of many organizations within a larger system. So it isn't just focused on a single outcome or a single program. Typically in an isolated impact approach, or a typical approach, is nonprofits work separately and compete to produce the greatest independent impact. Where in collective impact, progress really depends on working towards the same goal and measuring the same things, on truly working together. In isolated impact, evaluation attempts to isolate a particular organization's impact. How well are you doing? How well is your organization doing? How effective is this particular program? But in collective impact, large-scale impact depends on increasing cross-sector alignment and learning among organizations. So it's much more intermingled, much more working together, much more communication, much more common ideals and common measurements. In isolated impact, large-scale change is assumed to depend on scaling a single organization. So if something works well in your agency or your organization, all we have to do is make it bigger. In collective impact, again, we look at increasing cross-sector alignment and learning among many organizations. In isolated impact, typically today, corporate and government sectors are often disconnected from the efforts of foundations and nonprofits. Things aren't well connected. Where collective impact really looks to make sure that corporate and government sectors are essential partners and that organizations are actively coordinating their efforts and sharing lessons that they learn. So those are some of the stark differences, I guess, between what collective impact is and sort of how we typically approach solving social problems today. There are some sort of basic requirements. How do you get started in collective impact, and what's really different? There needs to be a commitment to a common mission. So it really reaches above individual and organizational goals. Trust among partners is key, and I'll talk a little bit more about this, and I think Joe will mention it later on, but the partners really have to work together differently. I know people who have been involved in collective impact efforts really talk about they have to sort of feel vulnerable and really put all their cards on the table and put their wallets on the table sometimes and really work together. So forming some strong trust among partners is key. And really a recognition that the whole is greater than the sum of the parts, that we can't look at just individual agency or organization successes, but we really need to look at how everything ties together. So there's sort of five conditions of collective impact. Folks have to have a common agenda. You have to have shared measurement systems. If we're going to try to achieve something and try to measure our progress, we have to make sure that we have shared measurement systems that align. And then we have to recognize that our activities reinforce each other. Even though for an example, a very small faith-based organization may be part of a collective impact strategy and may have a very small program, but their efforts and their successes reinforce what everyone else does as well. Another huge key is continuous communication. Folks need to stay in touch with each other about what's working, what's not working, about how we are achieving success together. And then, as I mentioned before, there needs to be a backbone support organization, some organization to sort of structurally hold everything together. I just wanted to emphasize those just a little bit more, the key conditions, because I think it's, you know, it would be easy to say, well, we have a great partnership and we really work well together and we're all working real well. And so how is this different? I think it's key that everyone have a common agenda for change, including a shared and I would argue a deep understanding of the problem and a joint approach to solving it. So everybody has to agree what the problem is and how we're going to try to solve that problem. Collecting data and measuring results consistently. So everybody has to share their data with each other. That's where a lot of the trust comes in. If we're not doing as well as we thought, we have to share that with all of the other collective impact members and try to figure out what we need to do to improve those outcomes. Also needs to be a plan of action that really coordinates how everybody works together and how our activities reinforce each other. And again, open and continuous communication. Trust is key. Make sure everybody has the same objectives in here and that there's a common motivation, that we're all motivated to make this happen, that we all have a passion for success, and that we stay in touch with each other to reinforce each other's efforts and to help each other through troubled times. And then again, that backbone organization has to have staff and skills to serve the entire initiative and coordinate participating organizations and agencies. So they act as cheerleader as well as technical advisors as well as scheduling people and logistics folks, but they really help hold the collective impact effort together. So if you were going to try to start a collective impact strategy in your area, the kind of things you would want to ask is, what type of social problem are you trying to solve? You need to be real clear at exactly what you're trying to achieve. Are you trying to reduce poverty? Are you trying to increase educational quality in high school or college graduation rates? Are you trying to make the community better prepared to deal with a disaster? What kind of problem are you really trying to solve? And what's your purpose in this? What's sort of the end result? What's in it for folks to participate in this? Why are you doing this? Because it's a good idea, because you have the money, or is it because you want a better community, a stronger community, a more resilient community? You need to be really clear and sort of the reason behind it. And then do you have a collective impact mindset? If you're going to try to start a collective impact initiative, are you willing to let go of things? Are you willing to be vulnerable to your peers and to other folks in the community? Are you willing to work with others and share in the success and see it as, you know, that the success of the collective impact group is the success of the whole community? And can you lead adaptively? So can you change the way that you lead your organization, agency, or the work that you do? And can you figure out ways to work with people from a very diverse set of backgrounds and interests? Can you work with bankers and lawyers and restaurant owners on a particular issue that they may not have worked with a lot before, and can you still figure out how to lead and work with folks in a constructive way? So I think all those things need to be considered, because it is very different than just sitting around the table with the usual suspects and coming up with a strategy for trying something new and innovative. I think this is very different. So there's some preconditions also, I would argue, for trying to get collective impact started. You need to, again, identify the problem in the community you're trying to solve. Who are the influential champions in the community? And not necessarily the folks who have been involved in this particular issue or problem, but who can help influence things in the community and who can become a champion for this effort. It's also really important to articulate the need for change. So why are we doing this, and why do we need to do something about this now? What's really the reason for making a change and for folks getting involved in this? And then the fourth sort of precondition is, are there some financial resources to help support this effort? In terms of implementing a collective impact strategy, sort of the reading I've done and what I've learned is that folks sort of say it goes through 4 phases. The first phase is really to generate ideas and dialogue, is to make sure that folks are talking about what needs to be done and what's happening, and that folks come to a common understanding of what the problems are, what the issues are, and what we want to achieve. The second phase is, well, you start doing it. You start to get things pulled together. You start to initiate action. and then you organize for the collective impact. You need the collaborative governance structure. You need to make sure you articulate and really define the common agenda and what the shared measures will be. You need to build that backbone infrastructure. Who's the backbone organization, or how is that backbone infrastructure pulled together? And then you really need to engage the whole community and build public will, get public awareness of what you're doing, and be willing to communicate with the public on an ongoing basis as to what's happening and how things are progressing. And then you need a plan to really sustain action and impact. How are we going to keep this going? How is this going to be sustainable over the long term? In terms of planning it out, you really need to do sort of a landscape scan. So what's happening in our community? What are the big issues? What's the baseline data that we need to collect? Begin to pull together that governance structure and establish some common goals and shared measures and formal boundaries, and then formalize that backbone infrastructure. In my mind, it's really getting a shared outlook and a shared sense of urgency, I guess, in terms of what needs to happen in the community, and to have conversations around those issues and get a real shared sense of what we need to do to move ahead. And again, include a diversity of people who aren't normally at the table talking about those issues. Bring those things together, find out what you want to achieve, formalize a backbone infrastructure, and then get everyone working together under a sort of coordinated strategic plan. And then sort of form work teams and begin moving forward. Sort of all those steps need to happen, I think, in order for collective impact to really take hold in a community or in a region. In terms of ongoing implementation, some of the keys are really systematically collecting data and evaluating on a continuous basis. Really, again, that issue of trust comes into play here. You need to really take a hard look at the data and evaluate what's working and what's not, and make changes that are needed. And that, again, is being vulnerable and talking about what's working and what's not working, and really get a process in place so that you can learn from what works and learn from what not works, and make course corrections as needed. Collective impact strategy should eventually include sort of a formal local partnership structure, data-driven decision-making. That's not a new term to most people, I think, and a way to do continuous improvement to make sure that you're looking at things on an ongoing basis and making changes as needed. In the long and the short of it, in my mind, collective impact is really about the community. It really reverses sort of the traditional nonprofit social change process. It begins by setting a goal. For example, increasing graduation rates by 20 points or reducing teen pregnancy by half, and then builds a system of nonprofits, government agencies, schools, businesses, philanthropists, faith communities, neighborhood groups, candlestick makers, bakers, community leaders, whoever, who can help create common strategies and coordinated activities among them to achieve the goal. So instead of each group's success being measured by meeting outcomes with their clients, everyone's success is measured based on how they help move the overall community result. Traditionally, I think nonprofits identify an isolated need, create a service for that need, and then demonstrate the results. And then you try to scale that up to serve more people in hopes of creating larger social change. Collective impact, however, begins with changing the community overall and then works backwards. I think that's really the key point. It's about change. It's about community change, and it really starts at trying to change the community and then work backwards. And as I sort of read and learned about community efforts in collective impact. I passed the information along to Joe Patrissi up at Northeast Kingdom Community Action. And Joe sort of has started to work with that, and I'll turn it over to Joe and let him talk to you about what he's been doing up in the Northeast Kingdom to move collective impact forward.
Thank you, David. So I just do want to thank David for sending me the article on collective impact. He just emailed it to me one day and said, read this. And I read it, and I was really, it just came into a place in my own mind where I had already been thinking but hadn't formulated the kind of deep, comprehensive, integrated strategy that this model offers. Because when I got up to realize that our nonprofit agency is an anti-poverty agency, the Northeast Kingdom Community Action Agency, and while we have really great partnerships with other nonprofits and with government, one of the key areas that really seemed to be missing from the equation and partners at the table was the business community. So what I really liked about what David sent me was the idea of diversity, a diverse set of community stakeholders building community to really all tackle one common problem. And wouldn't it have been great, I thought, if everybody really got behind the idea of tackling, breaking the cycle of poverty, and all pulling together to do that. And here was a model that actually created a roadmap of how to do that. So I started to, David networked it with me, so I started to network it with other groups of people and individuals that I worked with, including my own board, which is a diverse set of group of people. The way community action boards are established is there's sort of three parts. So there's the private sector, there's the government public sector, and then there's the community sector, primarily of low-income folks. So there's great diversity there. Share that concept with them, with the Northeast Kingdom Collaborative, which is a group of people that represent various sectors in the kingdom. And their role, the collaborative's role, is to become a catalyst for change in the kingdom, to lead to the result of economic resiliency and sustainability. Because there's too many places in the Northeast Kingdom that hook their economic future to one industries. Canaan and Island Pond, Ethan Allen, when they closed shop up there and walked out the door, hundreds of jobs left, devastated these rural communities. Gilman, the factory left. Years ago, Newport used to be a railroad town and really hasn't recovered since then. So there's deep poverty in the kingdom. One anomaly seems to be Harvard, which is a conversation for later on, is diversity of food industries, small food entrepreneurials there, diversity being the key word, so that if one person leaves, the whole place doesn't fall apart. So I networked this idea with the collaborative, with the board. I joined the Newport Rotary, you know, when I joined the Newport Rotary, it was kind of interesting because they really didn't know what NECA did. And here are the key business people in Newport, and they were, the first thing they said to me was, what can we do for you? Because our mantra in Rotary is service above self. So the business community did a project with our Head Start Center up there around reading and buying them books and Kindles and so on and so forth. So that was a keynote to me, that this possibility of reaching across the aisle to the business community to partner up with them to do something about poverty was actually something that could really happen. I got appointed to the Pathways Out of Poverty Council. We're networking the collective impact model with all the folks on that council, and there's a great diverse group there too. And with Patrick Flood, who moved up to the kingdom to take over Northern County Health Care Centers, which is a series of federally qualified health care centers throughout the kingdom, he really likes the idea too, and he's on the Pathways Council as well. And then I networked it with Merton. Why don't you do that? Thank you. Merton Bangman Johnson is the CEO of Rural Edge, and he's also the president of, president of the Northeast Kingdom Collaborative. And he liked the idea, and he networked it with Paul Bangstrom, who's the CEO of NVRH. And what was important about this was that NVRH, all the healthcare industries entities up in the kingdom they all understand that when you look at the Department of Health's webpage, you see all of the health outcomes in the state ranked by county, and the kingdom's outcomes are in really the cellar. Essex is last place, Orleans is second to last place, Caledonia is like in 7th place. So the hospitals, the healthcare entities basically got, you know what, if we don't do something about it, there's a correlation also on that page of the 2011 study called Group, I think it's called Group, I can't remember the name of the study, but you can see it. There's 2011 Group Diversity Studies or something like that, and the bottom line is that the higher the income you have, the more education you have, the better health outcomes you have. The poorer you are, the lower the health outcomes. So all of a sudden, the networking that Merton did with Paul led me to be invited to join the so-called A-team up there, which includes a bunch of other community leaders, Lisa Viles from the AAAs, and Ann Nygert from Linden State College, and Patrick Flood, and Michelle Tarrant from Northeast Kingdom Learning Services, and Paul, and Claudia Forte from North Country Hospital. All, John Sales joined us from the food bank. All are now talking about collective impact, and all are engaged in thinking about why don't we do a collective impact project and breaking the cycle of poverty as the major goal. And they even have a project leader in mind, David Reynolds, who's well known up there and very influential and amongst a broad group of stakeholders. So then Paul Bengstrom decided to ask his staff to apply for a grant. The grant was denied, but basically we're going to start this project up by taking money out of our own agencies and starting a core funding to get things rolling, and we're at that very initial stage of hiring David to go through the process that David Tucker was talking about. So it's likely that NVRH will become the backbone organization, or at least provide the space and the infrastructure and the support for a coalition to participate as the backbone organization. And why don't you tell this story, because you know this story better than I do about how NVRH was formed in the early 70s.
Well, I mean, Joe mentioned that NVRH would likely be a backbone organization, and I just told Joe that I remember in the early 70s, NVRH was really formed, and it's there because of a really grassroots community group in the St. Johnsbury area. Lots of community members. The old Bright Look Hospital was aging and really just wasn't up to modern standards, and there was a need for a local hospital in St. Jay, and it really was a community-wide group of people who helped get the hospital built and helped to attract doctors to the area, and really was a community effort to get that hospital where it is today.
But so we're at this very early stage of having non-traditional, non-profit folks who have influence in the community and who travel in business networks that are different than the usual ones I travel in. And here's where things get interesting, that when we start to build this coalition, there's two things that come to mind that are really big questions for me. The first one is presidents of banks, presidents and leaders of various business enterprises, people from chambers of commerce, social clubs like Rotary and the Lions and the Elks, all who have social missions. The question is, why should they care? Why should they come to the table? Why should they come out to a meeting that's going to potentially talk about breaking the cycle of poverty? What's in it for them? Well, it became really clear that it was very important for the health industry to look at dealing with poverty because it's directly connected to their outcomes and their mission. So there's a self-interest there. And there's a community interest as well, because if you're in the health industry business, you want to help people. But there's a double interest there. But to take a bank president and to have a phone call returned by a bank president, maybe Paul Bangstrom would make that call because he might have more influence in getting a return call than I might because he travels in those networks. Or he might be in Rotary with these people in St. Johnsbury. I'm in Rotary in Newport. The point is how to get people to the table. Why should they care? Why should they come? What would motivate them to come to a meeting? David talked in his presentation or his dialogue about the preconditions. And so this is one of the key things we really have to go to work in. How do we get people interested and engaged to come out from their busy days to talk about and agree upon a common goal, like breaking the cycle of poverty? It's obvious the kingdom is poor. The flip side of poverty is really good jobs and economic resiliency and growth and evolution. So interestingly enough, while we were having this conversation this morning with Paul Dragon and David and myself, I was talking about this interesting thing that's happening up in Hardwick, where there's a diversity of, instead of being hooked to a one-pony industry, and that industry leaves town and everything falls apart, what's happened in Hardwick is a diversity of small businesses all around branding of food. So if one person leaves, the whole place doesn't go down the tubes. It's really well branded with national distributions for craft foods like liquor and craft beer and Jasper cheese, and somebody told me there was a private equity fund there to start up businesses and so on and so forth. So it gets back to that question of how do we get people out? And Paul told me about an initiative in Essex called Heart and Soul, which we're going to go to school on because that seemed to galvanize the community in a positive way. They came out because there's hope in heart and soul. There's hope in economic resiliency and evolution. Poverty is kind of a dark subject. It's a different emotional resonance. So the whole question that we think we have to wrestle with is how to get people into this game if you all understand and buy into the fact that it does take a village to raise a child. Diversity is the key. Business and government have to work hand in hand to solve these major problems. So that's some of the things that we're thinking about and playing with in the kingdom. We're at the very formative stages. And just finish with the thought that if you watched the FDR series on PBS this week and you saw these two extraordinary leaders, Teddy Roosevelt and Franklin Roosevelt and Eleanor Roosevelt as well, the theme that kept running through the whole thing was, if some of us aren't doing well, we all aren't doing well. And that was their whole attitude about creating the New Deal and bringing the communities together so that we have strong communities, because the strongest community is only as good as its weakest link. So I'll finish there.
Well, thanks so much, David and Joe. That was great, introducing everybody to the collective impact model. We have some questions. The first one is, how do I find time for collective impact when I don't have enough time, money, resources, even achieve my own program's independent mission and meet the need at the door? So this is a real question about time.
That's a real good question. I mean, I think it is. And if I had a good snappy answer, I could pat myself on the back, I guess, but I don't have a real snappy answer. I guess, I would suggest that you look more into sort of what it takes to make collective impact work and just start bits and pieces reaching out to other people, organizations, and really start to talk about this, that in the long run, you'll be able to achieve better outcomes for lots more people and be able to work collectively with other people in vastly different ways. But you have to figure out some way to carve out the time. I don't have an easy answer. Joe, you did all of this in your spare time, I take it, right?
I realized something that you get into your job and you do your daily set of activities and you have your goals and your priorities, and you know, you're anxious to meet them all, and you have to juggle your time and manage and so on and so forth, and there never seems to be enough hours in a day. But when you step back from it and you look at what are you really doing and what are you really accomplishing, understanding that something like collective impact is a marathon, it's not a sprint. Just hold on to that thought. It really is. It's a marathon, it's not a sprint. It's a longer-term process that can produce real, meaningful change, and in the end, make your job easier. And it's sort of like the bank president metaphor I was talking about. Why should I care about poverty? My bank is doing okay. Why should I care? Well, if you're living in a community where there's a lot of poverty, and you have some good bank customers, you're doing well. Okay, but if you look way up the road, and you say, okay, if I invest X amount of dollars in scholarships for kids in the kingdom, for kids to go to college in the kingdom with the idea that they can access these scholarships, aspire to go to these post-secondary education programs, and in return for that, at least work in the kingdom for the first 3 years, that's a long-term marathon kind of perspective. So it's not, I would urge you to not think about how you can find the time, but how you can think about it, the issue and problem differently. And then maybe you'll change your priorities by looking at it that way.
The way I think of this is, over the last 9 months, we've talked about poverty from so many different angles, and rather than think about collective impact maybe as the other work or the next phase, it really is the work that we should all be doing. So incorporating it into your work is really key. We have another question. David, I know you're really connected around results-based accountability. AHS, the Agency of Human Services, and its partners are really promoting the RBA process. How does collective impact connect with the RBA process?
Well, I think it ties in terms of the population level outcomes in RBA. I mean, how do you achieve those population outcomes? And I believe that collective impact really offers you a way to think about how to achieve that. And you know, I would sort of piggyback some on what Joe said. It's really about thinking about how you're going to get there in a different way, and trying to reach out to different people in the community and engaging a wider group of people in the effort. And I think that's how you can achieve those population level outcomes. So I think it's a tool you know, that can feed right into the RBA framework in my mind.
Thank you. We have another question. What about the role of the client or the person that we are trying to impact? What's the expectation of how we include these folks in collective impact? For example, veterans in Got Your Six, or low-income people in collective impact initiative. How do you connect them to poverty? How do you bring them in?
Well, I think that's part of the belief behind collective impact, is that you need to have folks from all over the community involved, and that you need to figure out ways to get veterans groups involved, or veterans involved, or low-income people involved, as well as bankers and shop owners. And I mean, you do need to get different types of people together, and you really need to spend time, back to the previous question, you really need to spend time sort of building adequate trust among all the various players, because there will be conflicts and disagreement about how to approach, how to move forward, and you really need to make sure that that conflict is constructive and not destructive. And it's you know, it's thinking about how to solve the problem in a different way, and you have to reach out to, I know the 100,000 Homes initiatives do involve veterans on their collective impact groups, and they do have veterans actively engaged in their efforts. So it's you know, outreach, finding out what's important to them, just as you would engage other partners in the collective impact strategy. I hope that answers it.
Yeah, I think just to go a little deeper, this is connected. It was a question, but I think you kind of answered it. So we'll look at it as a comment, and maybe to drive the point home a little bit. The psychiatrist and Harvard University professor Chester Pierce coined the word the term microaggression back in the 70s to kind of describe a hierarchical process where people that were affected by social change were actually left out of the change. So microaggression theory is this theory that describes social exchanges in which a member of a dominant culture says or does something, often accidentally and without intended malice, that belittles and alienates a member of the marginalized group. How do you see collective impact maybe staying away from this theory or helping to overcome it, or do we fall back into that pattern inadvertently?
Yeah, well, you know, I think it's something that groups should really ask how truly inclusive their tables are and whether they're mitigating those natural power differentials. I mean, it could be between funders and grantees, large social service providers, and small faith-based organizations. How do you make sure there's trust and honesty as they work together on solutions? So, like, again, I don't have a simple answer, but that's something that does come up in the things that I've read about collective impact, is that the group, you know, again, I said early on, people need to feel vulnerable, and everybody needs to feel vulnerable when they're involved in these efforts. And the group really needs to look at, do we have everybody at the table? Is everybody at the table able to participate? How are we making sure that it isn't always the big agencies or the big guns or the big grantees or the big funders who are calling the shots and saying what's going to happen and how it's going to happen? How can we really redefine ourselves as we work together and not look at our individual successes, but look at our collective success, and making sure that all of us are doing well. And that would mean that some of us can't be not doing well.
I think also that in building the model, that the process itself is going to ultimately result in, over the 2 or 3 or 4 years of the project, the process work groups. So the constellation of those work groups really become critical. So when the strategies are developed and the measurements, the Uber goal is agreed upon, and then the measurements that measure the success of those goals, and then the strategies that are developed to achieve the goals and are measured to see whether they're working or not, those work groups are going to be small, and they're going to then come together and be coordinated for common big conversations by the project director. So if the diversity of the makeup of those work groups include the clients as equal partners, so their voices at the table, and they can become collaborators as part of the strategy development, measurement development, and goal development, I think that's staying true to the idea here that it isn't going to work unless it's truly diverse. So the bank president sits next to the Head Start policy council member, and so on and so forth.
And so when I think of, and we've had these conversations before about how we deliver services, whether it's through the agency or whether it's through our partners, and you think about that hierarchy, and you maybe think about some of the unintended consequences like microaggression that can happen. One of the things we've done recently, which I think is really innovative, and it's a model that comes out of Boston, and we've done this in conjunction with Capstone, where David currently works as assistant director in the Champlain Valley Office of Economic Opportunity, and that's the Family Independence Initiative, and that is cited as kind of a next generation collective impact model. So David, I'm wondering if you could just briefly talk about FII and what it is and how this connects to community collective impact.
Sure. The Family Independence Initiative is an effort that's now in Boston, I think in Oakland, California, and a couple other cities, and it really works with low-income people in neighborhoods and communities that it gets together people from those communities in groups of 10 to 15 folks, and the group sets its own agenda. The group sets its own goals for performance, and all the Family Independence Initiative staff members do is they pay people to report on their progress in meeting their goals. So you're paying people to report on their progress. And they set the agenda, they set the goals, they're totally self-directed groups. And what they've learned from that is that people take the steps that are most important to them, they reinforce each other, they form a sense of community, they network with each other, they network with other people in the group's networks, and they really are able to achieve significant successes in terms of further education, jobs, better parenting skills, whatever their individual family goals are. But the key is that it's really client-driven, that it's up to the group to decide what they're going to do, how they're going to operate, and people are going to decide what their own goals are. And I think how it fits in with collective impact, in my mind, is that it's not, the Family Independence Initiative is not about institutions or organizations doing things to people, but it's about people doing things for themselves and with themselves. So collective impact is not about, well, we're going to do this to our community, but collective impact is about, we're going to do this with our community, and we have to make sure our community is involved. So I think I see how that fits together. It's about building stronger communities. It's not about building stronger programs and services. It's about building stronger communities. I hope that answers.
Thank you very much, David. It does. Joe, I have another question here. Has the Northeast Kingdom Initiative zeroed in on the key measure it is looking to move the needle on?
Not yet. No, not yet. Actually, we're at the very formative stages of this, and there was some early talk about the goal, the overall goal being, well, if we tackle education and increase, the numbers of people going beyond high school to post-secondary education, regardless of whether it's college or certificate programs or whatever, that will deal with poverty, that will increase incomes, that will deal with health outcomes. And so there were some people who were like, let's make that the goal. So and other people are going, well, if we take care of poverty, that'll be, everything's under poverty. So if we take care of poverty, those things will emerge and rise up too. So we really haven't gotten to the place where we've gotten even consensus on what the goal is from the broad, diverse group of diverse stakeholders. The stakeholders the core group, I think, all agree on poverty for the most part. But again, there might be a couple that say education is the way to go. There's this thing too, I just want to tell you that I found out about a year ago called the aspiration quotient, which is a very interesting measurement of young children's aspirations to what they want to grow up to be when they become adults. And, it's sort of like, when I was a kid, my mother said to me, it's non-negotiable, you're going to college. If you don't go, I'm going to kill you, which she said with love, but the good news was I'll pay for it. And, it was like my sister and I grew up with the idea that it wasn't if we're going to college, it was where are we going to college. But a lot of parents there are a lot of parents that don't do that with their kids. And if it doesn't come from the parents or the education community or the community, the culture of the community, then that aspiration isn't necessarily there. It's an actual measurement that you can find a report of this on the VSAC webpage. And I've been told that the aspiration quotient in the kingdom is low. So this feeds right into the whole idea that we have this deep poverty up there. And it isn't like there's not a whole bunch of people in the kingdom who want to change that. The question becomes how.
And that's just a great plug for our office, along with the Childhood Poverty Council, our Exploring Children's Savings Accounts for Education. And that really is about that aspirational piece as much as it is about matching funds and funding for kids. Yeah. So anybody interested in that can email me at the Office of Economic Opportunity and find out about a meeting that we'll be having in late October at the State House. There's another question, Joe, connected to that. Assuming that St. Johnsbury, that you are going to be focusing on some area of poverty, which it sounds like you will be, how, given the overrepresentation of women in poverty, what is the group going going to do, and what are they doing right now in its formative stages to include women's voices? We know, for instance, in Reach Up TANF that well over 90% of the people, the adults in TANF are women. So what will you do to include women's voices?
I think that we have to really go through the process that David talked about, and when we look at the structure and who has to be at the table and that diverse group of stakeholders, that's where we're going to target the demographics around not just what you do, but who you are, and make sure that we have that representation there. It's like David said, this is a different approach. This is an inclusive community effort. So it has to be inclusive.
And it's, and what I've seen in sort of the more successful collective impact efforts really look at how members of the community are engaged in the collective impact initiative, and not as members of a focus group or a token representative, but really as active leaders and producers of services that will create and sustain long-term change. So it's really about engaging the community and helping to build the community.
There is a group too. I mean, it's really interesting because there's a group in St. Johnsbury called the Women's Professional, I think, Business Association. I'm not sure I've got the name totally right.
Business and Professional Association.
Business and Professional Association, which Kathy Mitras from my staff just went to the first meeting and is going to join. And here's a group of women that are professionals and have a social mission, and they can really be helpful in bringing that voice to the table, and also sponsoring and working with other women who are disenfranchised and who are on the marginal edges of the culture because they don't have money and they're just trying to get through their day.
So it's probably not by coincidence that you're both with Community Action and you're talking about collective impact. So we have a question here. I feel like collective impact was maybe part of the initial idea with Community Action. It's reflected in the legacy of the tripartite board and the flexible funding to community-based work to end poverty. Would you agree? And what do you think happened to move Community Action away from this model, and how can we bring it back?
I would definitely agree. And I think, part of what happened to change that was a change in sort of, well, a big part of it, not to mention any names, Ronald Reagan, a change in how community action agencies were funded by the federal government. It's no accident that flexible funding that you mentioned is called the Community Service Block Grant. It's about that shift in how the federal government funded community action agencies moved from community activists, community-based groups, really community-based solutions to poverty, to providing services to low-income people. And I think that was a big change in it. And I think just the way that funding has changed for community action agencies have really driven that sort of siloed, specific service, specific measured kind of approach. So I think how we get it back, I think that we look at things like collective impact, like the Family Independence Initiative, those kinds of things.
And I just want to say one thing. The thing I just really want to leave with, in my case, up in the kingdom, is that we're community action. We're not the backbone organization for this initiative. We're a catalyst, one of many catalysts. The ownership of this right now sits with NVRH and the A-team up there, and they're driving it, which is really, really where it should be. That's community action. The initiative for the goal of breaking the cycle of poverty comes from members of the community. It isn't the sole responsibility of the Anti-Poverty Agency.
And David, you have something to leave us with there?
Yeah, I just wanted to leave everyone with this thought. It's by Paul Schmitz, who is the CEO of Public Allies and the author of a book called Everyone Leads. And what Paul says is that I believe collective impact holds great promise for our communities to create sustainable solutions. However, to do this, leaders will need to build trust, coordinate their approaches, and engage community members in new ways. Leaders will need to be more collaborative, inclusive, asset-based, committed to learn, and accountable to implement this approach effectively. This is not how groups have worked before, and this is the challenge. And I think that's the challenge of collective impact. We have to do things differently.
I want to thank you so much for this presentation. I hope everybody out in the audience will get excited by collective impact, bring it back to your organizations and communities, and please remember to join us next month for the conversation on women in poverty. Have a great day.